I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
One person I would like to introduce before we start is Cindy Lemons. She is, for those who don't know, Pearl Prillhart's daughter. And Pearl Prillhart, with her other name of Peggy Maddox, started this organization some 35 years ago. And she just wants to offer one invitation.
Hi, good morning. My name is Cindy Lemons. Like you said, my father said part of me would always be Turner, and I know many of you knew Bob and Peggy Turner that were my parents. And so for a long time, in the origination of this club, you had to be 70 to join. And so now I'm glad to know that I can come and join and be part of this group as well.
Okay, I'm going to go ahead and introduce our program and get on to it. It's Rosalee Sites, and I think surely many of you know her. She was 30 years, she worked in the emergency department, 23 years as director, and then I'm going to let you have it here, but I'm going to let you tell what you're doing now and how that came about. And without further ado, Rosalee, it's up to you.
Put this stuff down.
Okay. Maybe we'll listen into that if you need to.
Okay. Well, good morning.
Good morning.
I was kind of surprised to get a call to come and talk about nursing, but I'm thrilled that you're honoring Nurses Week because this is Nurses Week, and I know they've got several things scheduled. Do I need to know the night? Okay. They've got several things scheduled at the hospital to celebrate nursing, and I know next week I'm going to have a display in the lobby for the Parish Nurse Program. But he wanted me to tell you what I started. Back in 96, 95 maybe, we had a change in administration at the hospital, and they wanted a senior program started. And their what they had an idea of a senior program was have a community-wide class once a month, get a discount at the dry cleaners, get a discount at the pet store, that kind of thing. And having worked ER for 30 years, I really didn't know much about working with older adults, except I knew they had strokes, heart attacks, and broke hips. And so I had to go around the city and learn about all the various services that we had serving older adults in Kingsport. And I also spent a lot of time in the library. And occasionally I would come across the term parish nurse. Really didn't know much about it. I called a couple hospitals that had such a program, and they told me about it. And it's where you have registered nurses connected with congregations of faith. And they said, we're having a national conference next week, and you ought to go. You would learn a lot. So I asked administration if I could go, and they said yes. So I went to Chicago to the national conference, and I thought, this is what we need. This is taking care beyond the walls of the hospital. And so anyhow, I came back and I went to administration and I said, this is what we need to do. And they said, I'm sorry, the budget's set. There's no money to do this. So I wrote a Robert Wood Johnson grant, which took me a couple months. And believe it or not, I got a $25,000 grant to start the Parish Nurse Program. So I went back to administration and said, okay, I've got the grant. And they said, well, go do it. So at that time, I hadn't talked with ministers. I thought, I think it's a great idea, but they may not think it's such a great idea. But I met with six, all but one had never heard of a parish nurse. So I had to educate them a little bit. But parish nursing is where a registered nurse works with a congregation of faith on being well in mind, body, and spirit. Try to keep people healthy, but when they're sick or having health problems, they're there to take them to the doctor, go with them to have procedures, check on them after they have. So they fill that role. They're a health educator, as far as having classes. They may not be the one to teach the classes, but they organize it. They're a medical resource person. You know, a lot of patients go to see their physician and they'll say, well, I hate to ask him questions. He's so busy. So I hated to bother him. And but they feel comfortable in coming to Kathy or Joy or whoever it is to have their blood pressure taken or to ask questions about a scan they're having next week. So they feel very comfortable. Thirdly, they're a visitation minister, so they do a lot of visiting people in the hospital, the home, assisted living, and they coordinate and organize work with volunteers, but they also are a teacher. Maybe in a classroom, but it may be one-on-one. So they have several different roles, helping people to integrate their faith and their health. Some people have never really thought about that. But anyhow, it's been a very successful program, very well received in Kingsport, and I appreciate that. I've been asked to come and talk about nursing in Kingsport. And since I've spent much of my life in Kingsport, being a nurse, I was pleased that you asked me, but also I thought surely there's somebody else. But thank you for asking me to come and share with you about nursing. Nursing has a rich history, of course, going back thousands of years. You've heard about the Florence Nightingales during the Crimean War, the Clara Bartons and all that. But I also need to note that there are local nurses who have served our armed forces in foreign countries over the different wars, and we need not to forget that. In fact, I have a little story I'll share with you. One of the things I did before I was diagnosed, I interviewed people to get their Meals on Wheels started. And so I was given a name. The United Way office gave me this name for me to get to go, and they said, maybe you should be the one to go do this. So I called the contact, which was this lady's nephew, and he said, I want you to know that my aunt has very short-term memory. He said, I'll tell her that you're coming, but she probably won't remember it. Well, so I said, that's fine, I'll explain. So I got there and I saw this mail hanging out of her mailbox and rang the doorbell. She came to the door. She's very straight, had great posture, very neat looking. Her house was very neat and clean. She said, well, come on into the kitchen. She had been working on paying bills and that kind of thing. And I asked her all the questions I have to ask her. Which door does she want the driver to deliver? All the things that we have to ask. But once I got through with my questions, she said, do you want to know something about me? And I said, well, yes, I would love that. She said, well, I'm a nurse. She said, I was an Army nurse. But she said, I started first at Holston Valley when I graduated. And she said, I lived in the nurses' home. And one of the things I was going to tell you, in 1935, when Holston Valley was built, they also built a nurses' residence that housed 25 nurses. But she had lived there. And so they after they get off shift, they were didn't have much to do. And they talked to one of the doctors, and the doctor said, well, why don't you put up a volleyball net? And so they put up a volleyball net, and they had a great time playing that after hours and getting some exercise out in the fresh air. Well, then the administrator learned of this, and he made him take it down. Well, this lady got angry, so she quit, and she joined the Army. And she served all over the world. She served in Okinawa, different places in the Pacific, and had a great career as an Army nurse. But interesting that she could remember all the details regarding her Army career, but yet she couldn't remember to get her mail out of it. But anyhow, I just thought that was an interesting story. But we do have numerous nurses in the area who have served our troops. But you asked about nursing in Kingsport. In 1933, the executive committee of the hospital was formed and was led by J. Fred Johnson. In 1935, the first medical staff committee was led by Dr. Yancey. In 1935, Holston Valley was built with donations from the community. There was also a nurses' residence, like I talked about, that could house 25 nurses. In 1936, the hospital was approved for a trial TB clinic, which was started as a single 2-patient ward, and the patients were limited to a stay of 300 days. And if you remember years ago, TB patients were sent off usually to sanatoriums. 1940, the nursing staff was depleted due to the war effort. So I'm sure nursing staffing was a problem then. 1941, Christine B. Trevey taught nursing 1 hour a day for 6 or 7 weeks with no compensation. And she continued to teach after that. In fact, the auxiliary named their nursing scholarship the Christine B. Trevey Scholarship. 1947, Holston Valley opened a practical nurses program with 10 students. 1954, ETS State College in Holston Valley entered a cooperative program which enlarged the size of the nursing training in this area. In 1958, the first class of this school started training at Holston Valley. 1964, a nursing shortage forced Holston Valley to temporarily reduce available beds from 362 to 334. So they had to close beds because they didn't have enough nurses. In September 1971, there was a picture of 27 nurses who was recruited from the Philippines to work in Holston Valley. John Dodson and Carol Oxley were the ones to go on the first trip. There was, in fact, 2 groups of Philippine nurses who came, and Carolyn Wallace went on the second trip. Some of these nurses stayed in Kingsport past their required contract time. In fact, we have a few that are still working in Holston Valley. In fact, if you have anything down in radiation, there's a nurse there, Aurora Hensley, who was one of our first Filipino nurses coming. She's a great nurse. Milligan College program started was in 1993 with her first class graduating in 96. They offer the generic BSN program. They have an LPN to RN program as well as an RN to BSN. They have not started a master's or a nurse practitioner program, but hopefully that's in their future. King College, the traditional BSN program, started in 99. The BSN and RN to BSN completed was started in 2003. The master's program was started in 2007 and a doctoral program in 2014. Lincoln Memorial has a nursing program, and technical schools have practical nursing programs as well as AD programs. Today, we're still struggling with nursing shortages. Today, we have 607 nurses at Holston Valley and 228 at Indian Path. I know that they've hired approximately 50 nurses that are going to be starting orientation here in June that have just graduated. So that will help some with our shortages. Nursing has changed over the years with more education required, more equipment and technology to work with. Staffing ratios have changed. Having pharmacists available. When I came to Kingsport and having a pharmacist available to ask questions, and I was just thrilled. I thought, what a luxury to have a pharmacist in the building. There were ER doctors who worked the ER. And when I first initially worked the ER, which was not at Holston Valley, but another hospital in West Virginia, we didn't have ER physicians. It was me, God, and telephone. So it was really wonderful when I came to Holston Valley and we had ER physicians, but they had just started like a year before I came. Nursing assessments were the most important tools that we had then and even today. Back in those early days, the only tools we had outside of a blood pressure cuff was using our senses, our eyes, ears, sense of touch, and smell. All were used in assessing a patient. Back then we had oxygen tents. Maybe some of you can remember that. But we had an oxygen tent that needed oxygen. We didn't have pulse ox to determine people's oxygenation level. So we had to use skin color, temperature, respiratory rate, nail beds, clamminess, pupillary response were all part of the patient assessment. All of this was using nursing observation as monitors were non-existent. Medications were limited, as were diagnostic tests back then. Back in the early days, there were no ICUs available, so critical patients were cared for on regular medical floors. There was no recovery services after the day shift, so those patients were reacted on the floor. There was no such thing as pagers to contact doctors or other medical staff. You had to use the telephone to contact doctors. You had to know the physician's office and home phone numbers, and somewhat of their routines. I even knew where some of them got their hair cut, so I could contact them for patients in emergencies. I have had to send the police to a physician's resident during the night when he went back to sleep after the last phone call and did not put the receiver back on the hook. Sterilizing our syringes and needles and checking the needles for burr after shift was one of the things that we had to do. For there's no such things as disposable needles and syringes. Advances in infection control changed all of this. Back in the early days, there were no disposable gloves. The only gloves were sterile ones that was used for surgery and sterile procedures. There were no IVs initially. IV meds, rather, I'm sorry. In fact, very few meds to work with. The doctors had to start the IVs and start blood transfusion. Nurses weren't allowed to do that. In the ER, we had to clean the instruments and trays and pack them to be taken down to central sterile supply for autoclaving. Today, they have disposable suture kits that are disposed of. As the years rolled by, of course, antibiotics had been discovered, and by then IV antibiotics became commonplace. Back then, we didn't have IV pumps to help control the volume and rate of fluids. We had to mark our IV glass bottles. We didn't have plastic bags. We had IV glass bottles, and so we had to take adhesive tape and mark at what hour the fluid was supposed to be so that we kept it at the proper rate. CPR was developed, and life support provided new ways to intervene when emergencies occurred and at the end of life. With CPR came ventilation, ICU care, and advanced life care and support. Dr. Smithy, a pulmonologist, came in 1973 and helped with the pulmonary patients, and care improved after that. The role of the nurse has always been important, but never more than now. We've come a long time. We've come a long way, and we could, at the time, we could do very little for our patients, to a time that now technology is a heavy environment, but it distanced us from those that we care for. The technology that improves patient care can cause us to lose our perspective and lose our personal touch with patients. You know, you can't concentrate on the screen all the time. You've got to look at your patient. Nurses must work to maintain that personal interaction with patient. The nurses have always been, and still is important to the patient. After graduation, this was at my home up in West Virginia, I worked a 52-bed unit. Now, speaking of staffing ratios, that's unheard of today. And I was the only RN on that night shift. I had 3 bedside workers to work with me. I always made rounds after I got my report from the off-going ship to see if the patients were awake, if they needed anything, such as cough medicine, pain medicine, or just to see why they weren't sleeping. One night I entered a patient's room and found the lady up. I introduced myself to her and asked her if there was something wrong. Was there something I could get her? And she said, "No, I've been waiting for you." She said, "During the day, there are more medical personnel around. I have my family and friends, but at nighttime, it's you and me." And so she wanted to know who I was. So patients still find nurses important to their recovery and want to know who they are as they play an important role in their recovery. They remember the nurse who started the IV, who put down their NG tubes, who gave them the chemo drugs, who gave them their discharge instructions, or the one who checked on them during the night when they could not sleep. Nursing assessment skills were the most important tools we had, and even now they're so important. So we still rely on those early nursing assessment skills. Nurses must work on this personal interaction. Like I said, it's so easy to get involved with monitors and buzzers going off and all kinds of pumps and this kind of thing. But, you know, the patient is still there. The patient is still apprehensive, needs reassured, this kind of thing. And patients come to the hospital. For one of the things they come for is nursing care. Patients need compassion and empathy and the human touch. Patients need to listen to their nurses need to listen to their patient. You know, we had a physician who just recently passed away, Dr. Don Bales, who used to always tell the nurses, if you listen to the patient, he'll tell you what's wrong with them. So I think that is good advice. Nurses need to remember that their patients are counting on them. They are important to their recovery, and they want to know who they are that's playing an important role for them. They need compassion, empathy, and the human touch. Think about a time that you were in the hospital, or maybe in the ER, or maybe with a loved one there. What makes you remember them? Was it their kindness, their thoughtfulness, their smile, a pat on the shoulder, or maybe it was a rapid response to an emergency situation? Do you remember that nurse? The patient may feel you're the only person who really truly cares about them, and that may be true. It was Winston Churchill who said, we make a living by what we get. We make a life by what we give. Other changes in nursing that have come, you know, years ago when you were in nursing school, you had a capping. After 6 months, you received your cap. And then after you got to be a junior, you got another stripe. And when you got to be a senior, you got to get the black stripe across your cap. And that was very individualized to your school. Each school had a different cap. Now, of course, nurses don't wear caps. They have pinnings. And I just learned here in the last week that some of those schools are going away from pinnings and are going to have a white coat ceremony. I thought that was reserved for doctors and pharmacists. But anyhow, things are changing. But other changes in nursing, let me go over. First of all, uniforms. In the early days of nursing, compliance with uniform standards was strict. We polished our shoes. We earned pleats in our aprons. The nursing cap was designated which school you graduated from. Your hair couldn't touch your collar. So if you had real long hair, you either had to cut it or put it on. You were not to wear your nurse's uniform off the hospital block. Or if you lived at home, stop at the grocery store in your uniform. That was unheard of. Nurses in most areas were not allowed to wear pantsuits until the mid-70s. And that was after I came to Holston Valley. I came there in '69. But pantsuit nurses were not allowed to wear. Surgical scrub uniforms were only worn by surgery personnel and physicians. Then in the mid-'80s, and a general loosening of uniform standards continued until recent times when everybody wore scrubs. Now they have brought about a change that colors differentiate the different roles. So nurses at I keep wanting to say Wilmot, at Ballard, the RNs wore gray scrubs. I think wearing scrubs, allowing the nurses to wear scrubs, has brought a casualness to nursing. It takes away from the neat professional appearance. I think I was one of the last nurses at Holston Valley to quit wearing a white uniform and my cap. But I think something in the white uniform said that I was a professional nurse, and it made you look like you had your act together, whether you did or not, Education in the early years, nursing schools were 3 years with a real emphasis on clinical experience. In fact, I was on the floor 2 weeks after I started school. That doesn't mean I was doing real patient care. I was making beds and those kinds of things. But 3-year programs were very heavy with clinical experience. Graduating from this type of school qualified you to take the state boards and be registered. You worked the floors during the days and nights, 3 to 11, but you were still required to attend your classes. In the late 60s, there was a move to push away from the clinical, the 3-year program, diploma programs, towards a bachelor's degree. AD degrees were also developed during that time. In those early years, there wasn't any bridge programs for the diploma nurses to get their BS degree. After moving to Kingsport, I interviewed with Marie Hawkins, who was the Dean of Nursing at ETSU, and told her that I wanted to start on my bachelor's. She told me that none of my education or 4 years of experience would count, that I had to start over and complete the entire 4 years. It was a ball game that I had to play. I had to fulfill their requirements. So I worked full-time and went to school part-time. And it took me 8 years to get my bachelor's because I had to complete the entire thing. Another 4 years to get my master's. Since that time, bridge programs have been developed. There are LPN schools, LPN to RN schools, AD to BSNs, master's programs have been developed, doctoral programs have been developed, nurse practitioners programs. So a lot of change has come in nursing education. Just to give you a difference, in my 3-year program, I had to go to Pennsylvania State Hospital in Pittsburgh to do my psych training because we didn't have a psych unit at my hospital. And up there I worked men's admission. Pennsylvania State Hospital had 3,700 patients. I worked men's admission, where they bring them off the streets of Pittsburgh. And I also worked the shock units. It was a great experience. I learned a lot. But when I went back for my psychiatric semester at ETSU, I spent a semester talking with a veteran at the VA on a park bench the whole semester. There was no comparison, but yet I had to do it in order to get my degree. Years ago, when graduating from nursing school, the only jobs for nurses included was the hospital, doctor's office, doing private duty, or school nurse. Now the sky's the limit for possibilities to nurse. They can teach, they can work with clinical trials, they can get certified in various fields such as critical care, emergency, maternal child, cardiovascular. They can do flight nursing, school nursing, health department, and of course parish nursing. I can't leave that out. So the sky's the limit as to what their interests are and what they want to do. As nurses are privileged to share very special moments in patients' and families' lives, it is, I'll share a couple things with you. It is the nurse who shares the joy of a mother who's holding her newborn baby for the first time. It is the nurse who is with a family when their loved one draws their last breath. To bring a smile to a critically ill child. To listen to an elderly lady talk about her family. It is the nurse who helps a family member get their elderly father who has dementia on his knees to be able to say his prayers, as was his routine. It was the nurse who made arrangements for a terminal patient requests to be baptized. It was a nurse who stayed with a critically injured 18-year-old and his parents who prayed for their son's recovery, but added, "It's not our will, but thy will be done." One time while working the ER, I got a family in whose house had burned, and they had a child who was less than 1 year of age. All had suffered smoke inhalation, including the baby. We had just gotten our new hyperbaric chamber at Holston Valley in the respiratory department, but it was one of our nurses who climbed into the hyperbaric chamber that night with that baby in order to comfort him and soothe him while he received his treatment. It was the nurse who taught a mother who had a new baby that was blind and deaf to hold her son with his bare chest against her bare chest, so that when she talked to him and sang to him, he would bond with her. So nurses plays a lot of different roles other than just giving pills and doing treatments. Yes, nursing has changed over the years, but there's still a need for nurses even more. They make a difference one patient at a time, and they never know the effect that they have on that patient. Nursing is not easy. Many times we have a big turnover in nursing. Nursing's hard. Nurses get discouraged. They want to find an easier, better hours without weekends, those kinds of things. But we know that patients still need to be cared for. Nursing, like I said, is not easy, but I've loved being a nurse all these years. And if I could, I would do it all over again. So this is Nurses Week. So if you know a nurse, thank her for all that she does. you will make her day. Anybody have any questions?
I wanted to state, one, I'd like to have a question I think a lot of us don't understand, and that is if you tell the difference in an LPN, an RN, and a nurse practitioner.
Okay.
How has the pay of nurses increased and the benefits they get?
Okay, let me deal with Alex's here first. Really, the name tag. Look at the name tag. Now, the RNs will wear a gray scrub. I haven't seen an LPN in recent weeks, so I can't tell you their scrub color. But I think you have to, I think you just have to look at the name tag. There's not as many LPNs as there are RNs, okay? And what was the other part of your question?
Nurse practitioner.
A nurse practitioner. Usually you see nurse practitioners in physician offices. Some of them have their own practice. The cancer center has a couple nurse practitioners. I know Dr. Goforth, not Dr. Goforth, we used to have a good Dr. Goforth in Rogersville years ago. I forget her first name, but she is down at the cancer center now and sees patients. But usually they're not in the hospital. You may occasionally see it, but they're usually in other locations. Now, you want to know about the pay. I have no idea what they make. I'm sad to say that because I'm not in the HR department and can quote that. And I know what my nurses make, parish nurses. I have parish nurses that are paid and some are volunteer. The ones that are paid are $12.50 an hour. It's a stipend. That's not what regular nurses make. And it varies according to the amount of experience they bring, their education background, whether they're bachelor's or an AD program. I'm sorry I can't answer that. I should have looked at it or asked HR for that, but I didn't. Yes, Dr. Reams.
I would just like to vouch for the teaching value of an experienced nurse. And all physicians, in one phase of their life, is a newbie. You know, he's an MD and so forth, but there's nothing better than having a seasoned nurse by your side in the middle of the night when you've got a real catastrophe on your hands. I read an article today that a first lieutenant outranks a sergeant major, but the first lieutenant has no experience in the military. The sergeant major has been there forever and ever, and the first lieutenant would be wise to pay attention to his advice from the sergeant major. So this applies in medicine, and it applies, every day. That a seasoned nurse gently guides the physician in the right direction. Sometimes, very appreciated.
Thank you for saying that. And I've heard physicians say, well, when nurse so-and-so calls and she's got an emergency, I know it truly is that. I know I worked at Montague General Hospital in Morgantown, West Virginia, while Bruce was getting his master's, and Dr. High School was our chief of staff. And we had residents from the medical school there, and he would always say, listen to your nurses. They'll keep you out of trouble. And so thank you for saying that. Yeah. You had a question.
Oh, well, what are the duties of a licensed nurse that a nurse practitioner, what is the difference in their duties?
Well, nurse practitioners can certainly diagnose and write prescriptions. With the RNs, we can't do that. The physician has to do those kinds of things. But the nurse practitioner is more into diagnosing, and like I said, they can order tests, x-rays, whatever's needed, but they can also write prescriptions. Yes?
What do CNAs do? Is that the name of them?
Yeah, CNAs do your basic nursing care. They bathe patients, they walk them, they probably do more than they used to do. But basic nursing care. But they don't do any medications or treatments, this kind of thing. But they're a big help to the nurse, very much so. Yes?
I'll ask one more question. I'll ask a question concerning electronic medical records and your opinion about how it enhances or is detrimental to patient care.
Well, with the electronic medical record, I know physicians have found it very frustrating to come on board with it, and it's a learning process for the nurses as well as physicians. I think as they go along, they get used to it. I think the electronic medical record is good in that various parties can look at the record and see what the physician wrote, but what the chaplain wrote, what physical therapy did. And years ago they had to flip through the charts to find that. Now they can just pull it up on the computer. So, I don't use a medical record in my area. That came into being after I left ER. So I really can't speak to that from a firsthand, knowledge, other than to hear the physicians talk about it. I know there've been a few physicians even retired because of electronic medical record. They just didn't want to have to deal with it. So it is a learning process, but I think it's the age in which we're living that it's necessary. Just to share a story with you, I was just telling my husband over the weekend about electronic records and being able to pull things up. He's having a medical issue, and his doctor was in Chicago this weekend, but he could pull up his films, his x-rays, and look at it, and he called him and told him what we needed to do. 20 years ago, that would have never happened. He'd had to wait to come back in the office today and get the report, but he was able to actually see the films. So not all change is bad. We certainly have moved along, but electronic medical records is a thing of the future. And also that you can go online yourself and pull up your medical record. You can pull up your test results. And so I think that's good. That's a change. What's your feeling as a physician about it?
Well, I've retired long enough ago that
Didn't have to fool with it?
I can't answer that question.
Okay, all right. All right. Yes?
Okay, what about the high schools? My children, my daughters, they had pink stripers or something?
Yeah, candy stripers.
Okay, yeah.
Yeah.
Candy stripers.
Well,
Can you talk about that a little bit.
All right. Well, I don't know that much. I was a candy striper when I was in high school. For 3 years, I worked every Friday night at the hospital from 3 to 9 p.m. But yes, they do still have them, especially in the summertime, mostly in the summertime program for the high schoolers. And I think it's a great opportunity for young people to see nurses in action and see other healthcare providers in action. Just maybe they're in doubt as to what they want to do when they graduate from high school, what they want to major in college. And so it gives them a good opportunity to do that. But yes, they do. It's, like I said, it's a summer program. It was interesting in that, if you said about candy stripers, we occasionally had volunteers to work ER, not a lot. But I had a young lady to call me one day and wanted to come and meet, and she said, I'm an airline stewardess. And she said, I'm thinking about going to medical school. She said, I've always wanted to go to medical school. And she said, I was wondering, could I come and volunteer in the emergency room? And we talked a little bit, and I said, well, yeah, you can. Now, she said, I can't come just like every Friday night, because sometimes I may be flying to Los Angeles or, whatever her schedule depended on. Well, she came and volunteered for probably over a year. And she made the decision to, yes, I want to be a physician. So she had already graduated from college, but she went back and went to medical school, and she's now an ophthalmologist in Johnson City. So, volunteers, volunteering does help people make decisions about what they want to do and to see if maybe they don't. We used to have young men to volunteer, or not volunteer, to work in the ER in the summertime. Some of them went on to be physicians. Some of them decided, I don't want any part of this. So, it's a good opportunity for them to experience that. I see Dr. McPatton back there. Anything you want to contribute about nurses?
Great benefit in your statement about the experienced nurses. When they called, you knew which ones were accurate, and you responded very promptly to them.
Yeah. Physicians always learned about the nurses who had the experience and made good decisions. So, yes.
How many parish nurses are in our community, approximately?
Okay, I have 28 at various churches. I have probably half of them are volunteer and the rest of them are paid a stipend. Dr. Smitty.
Thank you so much for being an example for the nurse who stayed with nursing and for your leadership, because what we see in nursing is a bit of turnover. A few years back at Holston Valley, we had nurses who were career nurses who really learned something every day that they shared with doctors and patients, and it was a growth experience that was invaluable. And today, I'm afraid that our nursing shortage is partly based on turnover.
That's right, it is.
And so we all need to congratulate those nurses and celebrate Nurses Week and pat them on the back and try to retain them where they are so they can have a career in nursing that hopefully might last as long as yours. Thank you.
Well, you probably won't find Biddy that lasts as long as mine, but thank you for making that comment. But yeah, the nurses who stay are just a valuable resource, but we do have a high turnover. Like I said, nurses get discouraged, they get tired. Nurses work 12-hour shifts now. Used to be we only worked 8. I've never been a fan of 12-hour shifts, but they work 12 hours. They have to work weekends. They have to rotate the nights. And so it's very hard when you're young, raising a family, trying to meet those requirements. And so I think that nursing administration and I think colleges are going to have to look at the training that the nurses receive, as well as I think that hospitals need to look at staffing standards, but also, you got to understand these people have families, and to work 12-hour shifts all the time is hard, and I certainly couldn't do it. I don't know about you, if you do anything for 12 hours, you get tired. So that's something that I think will need to be done. And I think schools need to look at the clinical experience the nurses get while they're in school, because when they get to the hospital, they're thrown into, yes, they have orientation, but they're thrown into situations that, they may struggle with and find difficult. And they get discouraged, and so they leave to find something different. Well, thank you for allowing me to come and share about nursing. It's a wonderful field, and I've enjoyed all of it. I can't say that it's always been easy. Working the ER all those years was difficult, but it was also a time that I wouldn't trade, because I learned a lot, and I was blessed with a lot of good physicians to work with, good nurses, and wonderful patients. So thank you.